Hi, this is Dr. Lin is in, the linking of science with nature. We are again with Dr. Michael Lin along with Dr. Desai. We were talking in our last segment about colonoscopies, and you were about to tell us the difference between a traditional and a virtual colonoscopy.
Exactly. Virtual colonoscopies have their own advantages and disadvantages, as does a regular traditional colonoscopy. The traditional colonoscopy, as you know, and for those who have had a colonoscopy, it requires a preparation. You have to thoroughly cleanse your colon.
Squeaky clean is what they say.
It must be squeaky clean because we're trying to detect polyps that are as small as 1 millimeter in size.
That's very, very tiny.
So our technology has to be able to detect that. Our gastroenterologist has to be able to detect that. And so most importantly, the preparation of your colon by the patient is of utmost importance. So that
I have to say that I've had them, and
it needs to be
squeaky clean, and that's, to me, worse than the actual procedure.
Exactly. So once you've done the prep, you're right, that is the worst part of the colonoscopy. Now, let me just quickly highlight the differences between a traditional and virtual colonoscopy. A traditional colonoscopy can detect a polyp that's 1 millimeter in size and bigger, of course. A virtual colonoscopy, unfortunately, can only detect a polyp that's 1 centimeter in size.
So that's 10 times bigger.
That is correct. The next advantage of or difference between a traditional and a virtual is that the preparation. People have the myth that a virtual colonoscopy does not require preparation. That's in fact not true. You need a colonoscopy preparation for both the virtual and the traditional.
As they say, squeaky clean.
And your colon must be squeaky clean.
No, I can't get away from that.
Another key importance is the sedation. With a traditional colonoscopy, you will be receiving medication to put you into a light to medium sleep. Unfortunately, with a virtual colonoscopy, that is not true. So you'll be wide awake with a hose, if you will, inserted in the bottom, and unfortunately, you will feel some discomfort. With a colonoscopy, you will not feel any discomfort. So the points are, with a colonoscopy, we are able to detect smaller polyps. The colonoscopy itself is painless or pain-free. And
you get to go to sleep. I mean,
you're asleep, but I forgot to mention the most important difference is that when you detect a polyp on a traditional colonoscopy, you are able to resect and remove it completely. When you have a virtual colonoscopy, unfortunately, you will detect a polyp, again, that is 10 times greater in size, which is not a great thing, but you will not be able to remove it. So what you're left with, you need a colonoscopy anyways.
Got it.
So now, can gastroenterologists do the virtual as well as the traditional, or is the traditional performed by someone different than
a traditional colonoscopy is performed by a radiologist. Who then they do something called a computerized tomography or a CAT scan, and they reconstruct the CAT scan to try to find polyps. In a traditional colonoscopy, we have a screen, and we are actually looking at the polyp directly, and we're able to resect it, identify if it's going to be a bad one, and remove it completely. So I feel, to all of our patients, we're not really recommending a virtual colonoscopy. We are recommending a traditional, regular colonoscopy, which means that the prep, you'd come for your colonoscopy, you go home, and as if nothing ever happened.
And one other thing is that I understand that the virtual colonoscopy can be used at first if somebody has a blood disorder, they bleed easily, things like that.
That's a very good point, and I'm glad you mentioned that, because there are indications for a virtual colonoscopy. And that happens to be one, and there's about 10 indications, and a board-certified gastroenterologist could tell you which one will be good for you.
If you want information on Dr. Desai, his website is listed for you right now on screen. If you want information on Dr. Michael Lin, you can go to drmichaellin.com, drmichaellin.com, and visit us at latenighthealth.com. I'm Mark Allen. We'll see you next time.